Welcome, everybody. Thank you so much for joining us today. My name is Sarah Ann Ellis. I am the Manager of Programming here at TMA. I want to thank you all for joining us for the FICA Incentives webinar. We're thrilled to be able to share this information with you and glad you could join us this morning. I do want to let you know this webinar is being recorded. Upon the conclusion of this webinar, I will be sending you the link to the recording so you can reference it in the future. Now, I would like to introduce TMA Bronze Partner Jim Taylor from Revenue Task Force.
Hi guys, thanks Sarah. Just wanted to let you guys know our group is always looking for government incentives wherever they are. A lot of times they're for building improvements and things like that. But we came across some government incentives that are pretty exciting, and I've known Eli quite a while. And Eli is the pro. He's going to walk us through it and how it works. So thanks.
Thank you. I know it's a busy time of the year, so I can certainly appreciate that you made time to join us this morning. So certainly appreciate that. We have a whirlwind amount of information to share with you in less than 20 minutes. So I'm going to actually move into it fairly quickly. And I promised Sarah Ann that I would not do too many dad jokes. In fact, I'm going to limit it to one, and I actually created this one is my own. What do you call a webinar that has scorching hot content? The answer, a webinaro. Huh? Get it? At any rate, with that I felt that was good. My so today, one of the things I wanted to cover up front is that we're going to be talking about a program that is going to save you money. It's also going to actually put money into your employees' pockets, and then it's going to have some added benefits. The one thing we're not going to be talking about is a program that's going to cause you or your people to spend a whole lot of time making sure that the program works. The work that needs to be done for this program is really done by us. We're also not going to be talking about health insurance programming. If you have your own current health insurance program, keep it. And the only reason I say that is because wrapped around this program that generates the FICA tax savings, there's a health program that the government is trying to promote in order to improve people's health. But this is not health insurance. So I'll make sure you understand that up front. And second, and thirdly, I guess it's important to understand that if you decide that this is something for you down the road, you're not going to be required to enter in a long-term agreement. You can cancel this program at any time. That's another nice feature. A lot of the owners of the companies we talk to like as well. They don't want to enter into long-term agreements and then be entangled into that kind of stuff. With that said, given the amount of material we're going to cover, I'm going to jump right in. Again, I'm going to go real fast, but then, at the end, we may have a time for one or two questions, and we'll talk about next steps. Hopefully you guys can see my screen.
Yes.
Yes, we can.
Thank you. Thank you. And if I can. So the program outline for today is we're gonna get right into the financial model, because I believe a lot of the people that are on this call because of the idea that we're saving money. We're going to focus on that first, going to go over some numbers. And then once we've done that, we'll go into how these numbers are actually realized through a review of the program structure. Then we'll conclude with some next steps. This is an example of a paycheck that would pertain to an employee who's earning, say, $31,000 a year, excuse me, with $15 an hour. That employee would be making $2,600 a month in income with tax withholdings of $435. Now, this is based on a state that has state income tax as well. And their net pay is $2,165. With our program, which is Employer's Choice, there is a pre-tax deduction that takes their taxable income to $1,400. On that $1,400, the FICA with the payroll withholding taxes drops to $159 for a savings of $276 per month. Now, the program, which we'll be describing in a minute, has a premium of $200. That comes off the $276. the employees are going to be required to participate in a 15-minute activity every month. It's a wellness activity. Once they participate in that activity, Employer's Choice reimburses them on a post-tax basis $1,000. The net result of all these things is that the employee has a additional benefit, a supplemental benefit, and they now have an additional $76 in their paycheck because their net pay after all this is $2,241. I'm going to show you an example for an employee that earns $100,000. Same idea. Employee at $100,000 is paid monthly about $8,300. Tax withholding of about $2,200, a little over $2,200 for a net take-home pay of $6,109. Participating in this program, there's a pre-tax deduction of $1,200, taking your taxable income to $7,100, and the withholding goes down to $1,794 for a savings of $429. They participate in the program with a 15-minute wellness activity and are reimbursed post-tax $1,000. The net effect of all these for this particular employee in a state that has a state income tax is $229 increase in net take-home pay. The net take-home pay goes from $100 to about $6,300, or in this case, about $2,700 a year. Now that's for the employees. What happens with respect to the employer? We're going to go with the $31,000 a year, $15 an hour employee who's earning $2,600. You'll be paying FICA taxes on this person of about $200. With Employer's Choice, the pre-tax deduction takes that taxable base to $1,400. You're now paying $107 in FICA tax contributions for a savings of $91.80. Administrative costs for the program is $35 a month. That comes off your savings of $91.80. The net of that is for every employee, you'll be saving about $57 a month or $681 a year. That's a lot of material. We're going to come back to this again and pause for a second on it later. But right now, I'm going to go into the program itself. And the reason I said earlier that this is not a health insurance program is because the government is trying to incent people to lead healthier lives. And they believe they could do that through this incentive program. The incentive program that we've got that we're going to be describing allows you to jump through the hoops that the government has created, so you are then entitled to this incentive program, and your employees as well can benefit. It's offered by Employer's Choice, and Employer's Choice is offering this through a partnership with the U.S. Health Center. I would recommend that you go online when you get a chance and look them up. They've been around for over 20 years. Gavin Kunis, who is the founder of the company, has been featured on numerous front pages of magazines. He's considered a guru in healthcare AI and IT. They also have thousands of participants, over 6,000 employers to date. And they have a program called PredictMed, which is an artificial intelligence program that drives predicting whether or not somebody has a need for any type of health intervention. It actually predicts it before the condition manifests itself. They've won numerous awards, continue to win awards over the years. And this diagram shows that, and by the way, these awards demonstrate that when they say they can improve lives, and in some cases save lives, they've been independently validated to actually are able to do that. The chart on the right-hand side simply shows for a client, when they start with Employer's Choice, what happens to the disease burden within their employer population. And you can see that in pretty much all cases for these chronic conditions, the disease burden goes down. And that's a particularly important item to keep in mind. Chronic disease is highly prevalent in the population. You've got 1,000 employees on any population of 1,000 people. 60% of the people in that population are going to have one or more chronic disease condition. And taking care of chronic disease is one of the most expensive parts of the healthcare system. The people in this category account for 85% of the cost in healthcare today. Just the heart disease case alone, 40 people, $1 million. That's $27,000 a year to take care of that chronic condition. This chart simply shows where U.S. Health Center's involvement over the last, for over a 5-year study, These are literally lives saved, people whose lives have been changed and and lives have been saved. People with all these particular chronic conditions. Imagine having a program in your organization that not only benefits your employees financially, but maybe even changes their lives, saves their lives, and just imagine what that could do for them, their families. What is it? It's an all-inclusive preventive healthcare management program. And as I said earlier, it supplements any health insurance plan that you have. If you don't have a health insurance plan, you can still participate in this because it is simply a supplemental wellness program. It is fully HIPAA compliant. If you're familiar with SOC 1, SOC 2 compliance, compliant with that. It's also compliant with IRS codes that you see listed here. And it's backed by a legal protection plan that no other organization offered this type of program offers today. And the nice thing about it is that when it's all said and done, the costs of the program come out of the savings. So there's no out-of-pocket costs associated with you participating for you or your employees. And how it works, as I mentioned earlier, employees have to participate in a 15-minute activity once a month. The one activity that is required is they complete a health profile. When they complete a health profile, it identifies what may be a condition that employee should look at. So it's unique to you. My health profile is going to be different than the health profile for Sarah and so forth. It's going to drive the modules that this thing is going to.
That's vision thing. I'm not. Good.
Okay. So, does somebody have a question?
I don't believe so.
Okay, well, so we're going to keep going. And so when you enter this health profile into the system, it's going to drive the modules. It's going to actually, over the course of time, develop a personal health dashboard, PhD. That personal health dashboard is going to tell every employee where they are in terms of the conditions that have been identified and how they're tracking to improve those conditions. Next slide shows you, for an actual case, this individual began the program in 2015. Anything on the 2015 column that's not green is not good. What you want to do is you want to move people from not green to green. And as you can see, by 2017, only one condition was a not green condition. This person is definitely moving in the right direction. What's included in the program is RN holistic health coaching. I don't know if you know about RN Holistic Health Coaching, but they're one of the premier nurse coaching programs in the country. They've been around for over 20 years. They've actually won numerous awards, and they've competed against the likes of people like Humana, Aetna, and so forth. And they have won awards in every single one of those categories. Included in that is telephonic coaching, nutrition education, behavior change counseling. This program also includes telemedicine. This telemedicine is available 24/7, 365, and there's zero copay and zero deductible for using this. This telemedicine program is for the entire family, not just for the employee. Included in this, and I have to update this chart because today there are over 100 of the most commonly used medications in use today in the country that are available to an employee and their family at zero cost and zero copay. And then, of course, the personal health dashboard, which enables an individual to monitor how they're doing in all these different areas with a library of modules that exceeds 250. And by the way, if you've got people that don't speak English, our modules have been translated into over 100 languages. So essentially, it takes a dual approach. We leverage Section 125 cafeteria plan to allow an employer to offer these programs on a pre-tax basis, and then we leverage our artificial intelligence that allows us to track the health of an individual through this application. And again, no out-of-pocket costs. Back to that example that I illustrated at the beginning of this. I'm going to pause in a minute. You can see this document shows how it actually results in a net increase in take-home pay for this particular individual. The numbers will differ depending on the state that you're in, and also they're going to differ depending on the salaries for the individual. But the $1,200 and the $1,000, those are fixed regardless of what person you're talking about. All an organization has to do is ensure that the data that we need to process the the payments are provided once a month. This is about a 2-minute, 3-minute amount of time. So you're not looking at asking your HR department or anybody who's running your HR, your payroll provider, to engage in an extremely time-consuming amount of time. We do all the work, and the administrative costs associated with this program is what really pays for the people that we have online to handle the people's questions, to do the onboarding, the training, everything else that needs to go with that. The $200 a month is what covers the program benefits that I described earlier, and then the $35 a month is what covers the administrative costs for the program. And I just went through a whole lot of material very fast. I certainly don't expect you to absorb it completely, although some of you might. But I do want to make sure that you have a minute. I think we've got a couple of minutes. Let me just one last thing. This is this slide shows what types of things need to happen, the time frame within which this program gets implemented. So if somebody decided today that they wanted to go ahead and move forward with something like this, it would be about an 8-week implementation. The 8 weeks is where we do all the work, and you can see the tasks that are associated. Most of the tasks that have to be done are completed by U.S. Health Center. The client really has a rather de minimis amount of effort required to do that.
What I like about it is I think we pay enough in taxes every which way we turn. We're paying taxes, and what I like about this is this comes out of money that you're going to be sending to the government anyway, and who knows if that's going to make it to anybody to actually help them. So you can take advantage of this and end up, saving a little extra money, paying a little bit less, you and your employee, and then there's some really awesome benefits to go with it. So I don't know, does anyone have any questions on it out there? Because he did cover quite a bit.
I don't have any questions in the chat, but if anybody does have a question, feel free to drop it in the chat.
Yeah, so essentially, as Jim was mentioning, this is a program that provides an opportunity for you to give your employees something they need, better health benefits. It also enhances their pay. And in our environment today, when you're dealing with inflation the way it is and pressures to recruit and retain employees, an opportunity to add more money to their net take-home pay is always going to be favorably received. And again, the FICA tax savings that you're going to see through this program are going to drop straight to the bottom line. And again, with no net out-of-pocket costs associated, because the program is paid for by monies you're already paying for the government through FICA tax savings. So
yeah, it works every single year too. It's not just the first year you do it; it continues.
right.
And, I think a lot of people would really appreciate the telehealth for the whole family, and then those free prescriptions, the top 100 or so prescriptions, because sometimes they've got 3 or 4 family members on some kind of prescription, and it might really add up, and
Yeah.
this covers the whole family.
Agreed. That is actually one of the best benefits that this program provides. But imagine taking a trip, getting a medication that you need for chronic care, calling the telemedicine line, getting the same doctor that you talk to every single time you call them, not some other doctor, and that doctor sends a script to your local pharmacy. Now you don't have to worry about the fact that you left home without something that you needed to take care of some chronic condition. So does anybody have any questions at this point? If not, I know that Sarah Ann has my contact information. If anybody wants so not everybody, not all organizations are ideally suited for this. I typically will engage in a 5 or 10-minute conversation with anybody who's interested, and really pre-qualify them to make sure that this is something that makes sense. And if if that actually works out, then we would schedule a much more in-depth conversation with our technical experts where they can go over some of the details of what needs to be done in order to launch a program like this. Has anybody out there heard of anything like this at in your experiences? If you'd like to say something, you can unmute your line.
I know this is the first time I've ever heard of these incentives, so I wonder if a lot of our members are in the same boat, that they haven't heard this much detail about these tax savings. And so that's why it's been so great to have you in, Eli, to kind of discuss these incentives. And I'm so glad that Jim brought you here so we could discuss this today and get the information.
Sounds good. Sounds good. We got a couple of minutes left. I don't want to jump off without giving. I know there's somebody out there who's probably wondering something about this, and don't be shy.
Well,
And
Eli, as you said, I have your contact information. If anybody also has questions, feel free to reach out to me. I will happily connect you with Eli to get you to the next steps for learning more about finding out if your company would be qualified for these tax incentives. I know that we did finish a little bit early, but I would like to just thank Eli and Jim for their time this morning. I appreciate their efforts in putting everything together and getting us here this morning. I appreciate everybody who joined today. I will end the webinar. Feel free to stay on if you have a question. But if not, I just want to thank everybody for your time this morning and hope to see you all soon and have a great holiday season.
thank you, Sarah, and I appreciate allowing us to be to share this information.